Welcome to Dental Notes and Mnemonics, and today we'll be discussing about the differentiation between cyst and tumor. This is the first part of diagnosis series, and hopefully in the future I'll be presenting more topics or more parts of this series only. So without any delay, let's get started with the topic first. The first textbook of oral pathology, the definition of cyst is it is defined as a pathological cavity that may or may not be lined by epithelium and contains fluid, semi-fluid or gaseous material. It often forms within the soft tissues or bones and is commonly associated with odontogenic or development origins in the oral cavity. On the other hand, a tumor, also called as a neoplasm, is an abnormal mass of tissue that results from uncontrolled progressive cellular proliferation. Tumors can be benign, which are non-invasive, and when they become invasive or metastatize, they are termed as malignant. So these definitions provide a clear basis for understanding the fundamental differences between cyst and tumor. Let me explain this in simple terms. Imagine a water balloon is there. When the balloon is filled with water, it expands but still remains smooth and filled with liquid. That's what a cyst is like in our body, a fluid filled sac. On the other hand, if we think of a tree growing in the wrong place, a benign tree stays put but takes up space, while a malignant tree sends root everywhere, causing the damage. So in the same way, a benign tumor stays localized, but a malignant tumor spreads. A diagnosis of both these lesions can be made on the basis of the clinical examinations, radiographs and biopsy, where a tissue sample is taken for histopathological examination to confirm if the lesion is benign or the malignant. Simple mnemonic to learn about or to memorize the key differences between cyst and tumor is: for cyst it is cavity with single letter in the word is representing a mnemonic, and while in case of the tumor we can use a mnemonic growth, where in this also the single letter ahead of the word is representing a feature or the key difference between these two lesions. I request you to pause the video here and take a look on these differences, though I'll be discussing these points in detail in coming slides. Clinical considerations or the characteristics. First, we'll be discussing with the symptoms the patient faces in case of cyst and the tumor. In case of the cyst, the patient is usually asymptomatic. They may cause mild swelling and discomfort to the patient. These are usually painless, as we have already discussed, but certain cysts, when they become infected, they become painful. Benign tumors grow very slowly, and they remain localized. They remain asymptomatic for the long periods but can cause symptoms if they compress nearby structures. In case of malignant tumors, they often present with pain, swelling, and may lead to the systemic symptoms like weight loss. Benign tumor, ameloblastoma, is an exception, although it is benign and can be locally aggressive and may require the wild surgical excision. In palpation, cyst may feel soft, fluctuant consistency and may feel fluid filled too. And in case of tumor, it feels firm or hard consistency and may be fixed or mobile depending upon the tumor type. In case of tumors, the teeth may be displaced, but the roots often remain vital. And in case of tumor, teeth may be mobile or displaced, especially if they are invasive. The mucosa of a cyst appears to be normal and slightly raised, and in case of the tumor, it may show the surface ulceration, color changes, or the induration of the mucosa. In case of the inflammatory cyst, there may be the presence of redness or ulcerations. Regarding the location of the cyst, these are commonly found on the apex of the teeth, like radicular cyst, or around the unerupted teeth, as in case of dentigerous cyst. While on the other hand, tumor can occur anywhere in the oral cavity. A location may suggest the origin. For example, if the tumor is of the ameloblastoma, then it is most commonly found in the posterior mandible. Here I have provided you two charts for the common oral cyst with respect to their location in the oral cavity. Please pause the video here and go through these two charts once. After the clinical features, we will be discussing about the radiographically how can we differentiate between a cyst and the tumor. Cysts appear as a well-defined radiolucent lesion on the radiograph. The margins are smooth and corticated, indicating a benign nature. In contrast, tumor may also be present as radiolucent but can show well-defined or poorly defined margins. Some tumors like osteosarcoma exhibit mixed radiolucent and radiopaque features, indicating a more aggressive behavior. Ameloblastoma appears as a radiolucent soap bubble or honeycomb appearance. In the radiograph, with the exception of odontoblast, although it is classified as a tumor, it appears as a radiopaque mass due to the presence of dental hard tissues. If we talk about the size and the shape of cyst and tumor, cysts generally have a round or oval shape with the sizes varying from small to large. They may increase in size over the time, leading to the displacement of adjacent teeth. While the tumors can take on irregular, lobulated or infiltrative shapes. Rapid growth is often the feature of the tumors, resulting in significant changes in the surrounding structures. Radiograph cysts often appear homogeneous and may contain fluid level if infected. For example, a dentigerous cyst may show associated unerupted teeth within the radiolucent area. The tumor can display a variety of internal structures, including calcifications or bone formation. Some tumors may present with both radiolucent and radiopaque areas, indicating mixed lesion, which adds a complexity to the diagnosis. Biopsy plays a crucial role in diagnosing cysts and tumors, differentiating between benign and malignant lesions. Suspicious cyst with atypical radiographic features, rapid growth or changes in the characteristic, showing a sign of infection or the discomfort, and the cysts which do not resolve after the initial treatment warrant a biopsy. In case of the tumor, if the tumor exhibiting rapid growth, pain and systemic symptoms like weight loss, tumors showing the destructive pattern of the mixed radiolucent or radiopaque characteristic on the radiographic analysis should be biopsied. And tumor that do not resolve or change after the treatment also warrant further evaluation. Let's talk about the treatment in brief of both the lesions. Small cysts may not require treatment if they aren't causing any problem. In case of larger cyst, it might need drainage or surgical removal to prevent infection or damage to the nearby tooth. In case of the tumor, benign tumors may be removed surgically if they cause discomfort or cosmetic issues. And in case of malignant tumors, they require more aggressive treatments including surgery, chemotherapy or radiation therapy. I conclude this video, and please go through these charts where I have given superlatives of cyst and tumors in the oral cavity. This would be very helpful to you, and I hope you found this video helpful. If you have any questions or would like to know more, feel free to drop your comments below, and don't forget to like, share and subscribe to the channel for more updates on topics like this. So see you in the next video. Till then, bye bye, take care, have a nice day.